Good afternoon. I'm Mark Bryant, the Public Information Officer for the Mobile County Health Department. I'm here today to give you the COVID-19 coronavirus update for April 2nd. Again, unfortunately, for the second straight day, I have to start off with sad news. We've had our third confirmed case of a death of a Mobile County resident from coronavirus. The individual was a 56-year-old male. He had a history of underlying medical conditions. He had presented to the hospital with known COVID-19 symptoms and was hospitalized. From Dr. Eichel, we are sad to report our third death in Mobile County. Everyone should take this illness very seriously and keep persons infected in their thoughts and prayers. Something that we started yesterday. It's caused a lot of interest in the media and the public. Now that we've hit 50 confirmed cases in Mobile County, we're able to start doing some demographics on the patients. So this is through 57, the first 57 cases we had. Out of that number, 17 were hospitalized and 3 have died. As for age, the majority, 38, 66% were between the ages of 19 and 64. For gender, right now it's split between male and female evenly. For race, African Americans make up 52%. For the hospitalized, 9 were between the ages of 1964 and 8 were above the age of 65. And then for zip code, this has caused a lot of interest. 9 were in 36608, 13 were in 36695. We can give those exact zip codes because they have at least 20,000 residents. That is a HIPAA federal regulation. Now for zip codes beginning in 365, there have been 9 cases. And beginning in 366, there have been 22 cases. Now, all this information, if you're interested, you can get the details. We've uploaded it to our Facebook page, I Love Mchd. You can go there and get that information. As of this morning, the latest numbers across the state for confirmed cases were 1,161. In Mobile County, there were 61. Reported deaths throughout the state, 32, and of course in Mobile County, 3. Dr. Eichel did want to add this one other comment. Young persons need to take COVID-19 seriously. There were reports of both 20 and 25-year-old males dying as a result of this disease. Now, that wasn't here in Mobile County, but in the nation. Please only gather online and observe physical distance of 6 feet from other persons. This should include car passengers and less family. Well, last night, Mayor Sandy Stimson of Mobile sent this information out on Facebook regarding the big box stores where the health department is trying to encourage people, to practice social distancing things. So the mayor's office and the city council have picked up on this. This morning, I visited 4 big box stores to check their progress on limiting the number of customers inside. I was encouraged to see that they were all embracing the new guidelines we introduced in our executive order, which take effect at 7 a.m. on Thursday. And talking with store managers, they acknowledge they have a responsibility to keep their customers and employees safe. Several of them were using apps to keep an exact count of the number of customers inside. So we applaud the city for that. Hopefully all the other municipalities and in the county are also looking into this. The key things, there's no vaccine, there's no special drug to treat COVID-19. The best things you can do is the social distancing, staying at home as best you can, keeping your hands clean either by soap and water, or if you're outside, take the hand sanitizer with you with at least 60% alcohol. And cleaning high contact areas such as doorknobs, any place, because the COVID-19 virus is not really an airborne. It's it's normally it's droplets when infected people cough or sneeze that spread it. And just if you touch a surface where someone has coughed, and you touch either your mouth, your eyes, your nose, you're getting the virus inside of you. So it's very important to keep your hands as clean as possible and try to avoid contact with your face. For negative test results for Mobile County processed by lab, we're at 572. And for statewide number of people tested, it's 8,619. Now, when we first introduced the demographics yesterday, we had some questions from the media, and Dr. Randy Murphy, our epidemiologist, who's been working with the state health department to compile this information, has answered. The first question: are the hospitalizations the total number of cases that have result in hospitalization at any point, or are those number of patients that are in actual hospital as the data is released? The answer is the total number of patients hospitalized at the time of testing or following a positive test that we know of. Again, there are also options for yes, no, or unknown. Could you explain how that information is gathered, and how are those cases, whether it's unclear if the patient was hospitalized? We asked this question during the initial interview. Some unknowns are recent cases that we have not interviewed. Some, but not all, call us after the interview to let us know that they've been hospitalized. This week, the ADPH is initiating a follow-up survey for all COVID patients to collect outcomes, but for now we don't know. We don't have that data for all. Is the total number of hospitalizations cumulative? Yes. The last question is just about the number of patients that have recovered. Is there any data available about the number of patients in Mobile County known to have recovered? Again, this week, ADPH is initiating a follow-up survey for all COVID patients to collect outcomes. So we don't have that data yet, but as we progress, we gather more data. We'll share it with our elected officials and, of course, with the public. Another question from the media. Does the presence of COVID-19 antibodies mean someone previously had the disease and now is immune, or does it mean that person has the disease but is yet to develop symptoms? The presence of COVID-19 antibodies indicates previous exposure to coronavirus. The presence of antibodies doesn't guarantee immunity, and it doesn't detect infection. Okay, one more. Do you know what policy is for minors who test positive and require hospitalizations? I know we've only had the one case, but it's worth asking. Maybe if folks knew they couldn't accompany their sick child in the hospital, they would stay home. Our answer is we've been told that would likely be a hospital policy. We have no knowledge of a public health recommendation on this topic, but that does not assure that there's not one that we're not aware. So that kind of wraps up everything that we have today. So far, the high points, we've had our third confirmed case, and then we've got more information on the demographics on the different for age, sex, race, hospitalization, and some limited issues on zip codes. Again, if you would like to see this information, a lot of it is on our website, mchd.org, and on our Facebook page, I Love MCHD. We encourage you to follow those. We're posting information from the state, the nation, locally. It's whatever we can to help everyone get through this time. So that is it for today. Thank you, and we'll see you tomorrow.